Welcome to Patient No More, the American Healthcare Survival Resource. Our new series is called The Advocates. I want you to meet the wonderful people who are working to fix healthcare to make your lives easier. This episode is for caregivers. Our guest today, Neal Shah, has founded two nonprofit companies you're going to want to know about. Both were born out of his personal experience of becoming a caregiver in his mid-30s. Because of that, he shifted his life's work from banking, private equity, and hedge funds to improving caregiving and supporting caregivers. Neal is CEO of CareYaya, which helps caregivers get affordable assistance from thousands of healthcare students across America. We're talking about hiring medical and nursing school students for about half of what I paid hourly for my parents' care. And because caregivers don't have the time or bandwidth to fight with insurance companies, he started Counterforce Health AI, a free platform that does the hard work of appealing health insurance denials. Here's Neal to tell you all about it. So, Neal Shah, I am so happy to have you on The Advocates today. And we have so much to cover. I'm excited to talk to you about CareYaya. I'm excited to talk to you about Counterforce and all of the things that you've been doing. And I think that my Substack audience and your Substack audience are going to be eager to hear what it is that you have to say today. So welcome.
Yeah, great. Thanks for having me on, Helene. Really appreciate the opportunity.
So let's talk first about CareYaya. Can you please describe what CareYaya is and why you decided to focus on caregiving services for the elderly?
Sure. So we're a technology platform that connects people who need care at home, taking care of loved ones, so family caregivers of cancer, dementia, many other diagnoses, with companion care from tomorrow's doctors and nurses, healthcare students at top universities around the country to be the caregivers. Critically, I think the most important propositions for family caregivers are it's the most affordable respite care in the country. We're averaging rates of around $20 an hour compared to traditional home care agencies that charge $40 or more per hour. And we have a very unique workforce, which is top pre-medical and nursing students at most of the top 50 universities in the country. We're actually now running one of the largest care workforces in America, over 50,000 students on the platform. And it's really cool to see. So it's more affordable, it's more convenient to book, all digitally and online, kind of like many people call it the Uber of caregiving. And it's, in my opinion, the highest quality care workers. So really wanted to make it
about that. Let's talk a little bit about that affordability, that $20 price point,
Sure.
Because I can say, so my mom passed in 2023, and the last 2+ years of her life, I was spending over $300,000 a year for caregivers.
Oh my God. Wow.
We did have insurance, but the insurance covered about 85,000 of it.
Yeah.
So the out of pocket was way over $200,000 a year.
Yeah.
And it was her money. We had to sell her place. It's just killer. The cost of caregiving is killer. And you have a $20 per hour price point. How do you make that happen?
Yeah, great question. So here's how the industry doesn't make that happen. It's they charge you $40 an hour and they typically pay the care worker $15. So in my opinion, this is an absurd problem in America that everybody's complaining about caregiver shortages and everyone's complaining about caregiver cost, to the families, but it's really the industry is not innovating. It's a very old school 1980s, 1990s type of industry. And I think that we, through tech innovation, have significantly brought down the overhead costs and the administrative waste that the old school industry is doing, and we're able to pass along those savings. So I kind of view it as the mission of CareYaya is to be like Costco. You know how Costco delivers like amazing goods at the best prices that are high quality, just by being razor focused on like thin, kind of markups and margins. I love Costco, as a consumer, and I kind of like thought in starting CareYaya, it's not a price versus quality. It's you can do both. You can lower the price. You really go for extreme efficiency, use tech to streamline onboarding, streamline matching families with caregivers, streamline all the reminders of shifts and everything, and then significantly bring down the cost. We don't pay anything for advertising. We don't have local salespeople. We're like reinventing the way the care industry operates. And the end result is that families get better care cheaper. And, that's our mission.
Well, you're a nonprofit, which is a really big deal. So you're getting grants to make this possible.
Yeah, it's full out. I'd say we're kind of on the spectrum of like we're not a business in the traditional sense. We're not a full 501(c)(3) in the traditional sense. We're a social enterprise, and as a result, we're eligible for both funding. A lot of our programs are funded by donors, foundations. We've gotten a lot of grants from research universities, Johns Hopkins, University of Pennsylvania, which the work I'll talk about later, and we were also funded by the National Institute on Aging, as well as AARP and American Heart Association Social Impact Fund. So thanks to this funding, we're able to deliver a lot of our technology innovation at no markup or additional fees or cost to the family. So all the money the family pays goes straight to the student. And as a result, students are able to earn good income. In most markets, they're earning more than the traditional care industry pays. And then the family's paying in most markets 30 to 50% lower than through the traditional care industry. So it's better for students, it's better for families, and I think it's overall it's better for society.
So let's talk about it from the patient and the caregiver perspective. I'm
Sure.
presuming both caregivers and patients themselves can call you up or go on the
Hmm.
website and match with a caregiver.
Yes.
So
Yes.
I ran through the process myself a little bit. I didn't go all the way to booking
Great.
somebody, but
Okay.
how do I judge as a caregiver or as a patient? How do I judge which of those 4 or 5 people that you've presented to me are
Yeah.
available and right for me?
Yeah, so typically what happens is we try to streamline it as much as possible. If you book, let's say 5 days a week, you need help, and starting next week, what will happen is our system will pick and best match the top 2 to 3 people to come help you, which are students nearby, your area. So if you're in New York, most of the students are either at Columbia, NYU, or Hunter College. If you're in like the Boston area, they're at like Harvard, Tufts, Boston University. You'll get matched with, the top 2 or 3 students suitable for you. And for the first week or two, you'll all of them will help, and then you get to select each one. You leave a rating and a review and decide, do I want this person back or not? What we find for most families is because these are full-time students, typically a
Mhm.
care team develops, if like anywhere from 2 to 3 or sometimes 4 people taking
Right.
turns and rotating depending on the day of the week. And then it's good for family and it's good for students because it reduces burnout. It reduces the chance that if somebody calls out sick, you have other people available and on hand ready to help you. And then oftentimes the students graduate and they go off to medical school or nurse practitioner program somewhere else out of state, and then they may not be around. So you kind of get a continuity of care and a care team developing. So yeah, it's pretty streamlined, and you don't have to do all the burden of picking just off a profile. You'll actually experience the care and then get to choose, do I want this person back or not?
So for the medical school students and the nursing school students, how do they work 9 to 5? I mean, how are they doing the daytime
Yeah.
if they're supposed to be in class?
Great question. So many of them don't have classes on certain days, so they're able to do day shifts. Many of them are doing it during what's called a gap year. So oftentimes after graduation, people will take a year or two off before they go into graduate clinical programs. So
Mhm.
many of them are doing during then. So those are the two. And then also I would say actually the most popular shifts on the care platform are evenings, weekends, and overnights. Those are big things that people need help with on care, and those are things we can really deliver well. But people are booking at all hours. Like today, we have, hundreds of shifts going on throughout the country that are in the middle of the day, that are going to be starting in the afternoon, that are going to be in the evening, that are going to be overnight. So yeah, people can get help in any way.
How
Um,
much warning, far in advance does a caregiver need to call you to get someone in? And, like, is
sure.
there an emergency help service?
We try not to do kind of like ad hoc because it's a lot of matching and administrative complexity. But for the most part, if people need help, usually in less than a week, we can be able to dispatch someone, and sometimes in less than 2 to 3 days. On average, most people book a week or more out if they're new. Now, that's when they're new, brand new to the platform. Once they're already on the platform, then they can do ad hoc all the time. So we have people that once they've made it through our vetting process, because we also vet the families for student safety, so we do onboarding calls with everyone and we check the families, we run background checks on everyone, et cetera. So once we also vet the family side and you're in the system, then you can use it like Uber. Like if it's 2 o'clock today on a Tuesday and somebody books and they need help with their mom or dad covering a night shift at 8 p.m., like probably 90% chance that'll be able to match just using the technology.
So when I was using the far more expensive
Yeah.
AIDS service for my mom,
Hmm.
some of them were just, home aides. Some of them
Yeah.
were certified registered nurses or CRNs. One was
Yeah.
actually a registered nurse. I
Wow.
had so many different levels of care because we were
Yeah.
patched together 24 hours, 7 days a week.
Yeah.
Even when
Yeah.
I was there, I made sure that there was an aide there. I know CareYaya's employees are not permitted to do any medical duties. So that
Yeah.
includes giving prescription medicine,
Yeah.
right? So, and they can't do baths or showers, um,
Yes. Yeah. So
which,
for CareYaya, it's companion level care only. And that's where we wanted to start because that was something that we could deliver at scale in a safe and effective manner with a wide spectrum of healthcare students, including we have a bunch of people that are CNAs, we have a bunch of people that are EMTs, but we also have a bunch who aren't. And we wanted to make sure we didn't exclude anyone, who's like interested in being a healthcare professional later that are welcome to do the program. So for now, we offer companion level care only. And over time, we may introduce the higher acuity versions. I think what's beneficial for the families is this. For people who need companion level care, like let's say in the case of your mom, for 24/7, the prevailing market price might be over 300,000 a year. If you're doing it through CareYaya, you'll probably end up paying less than half that.
right.
And, people can deliver it well. So we do find people are supplementing it with care they're getting elsewhere for the clinical needs. So a lot of times we help people in hospice, in palliative settings where the nurses might be covering the 3 to 4 2-hour shifts a week where the clinical stuff is happening, or even where bathing and et cetera is happening. And then they're using CareYaya for all of the companion needs. That does work well. But we also sometimes just serve a different pool of people who need companion only, which are oftentimes early to moderate dementia or someone going through cancer treatment. Yeah.
Um, so because of all the people you have who are using CareYaya services,
Hmm.
you came up with this really cool AI platform called Counterforce. Can
Yeah.
you talk a little bit about that, how it came about, and what it does? Because I'm completely blown away by this.
Yeah, yeah, sure. So I think both of these are born out of personal and professional experiences. Before I started CareYaya, I had dealt with family caregiving for my grandfather through dementia and for my wife through cancer. And in both cases, home-based care I just found was extremely low quality and hard to access and unaffordable. So, I'd end up relying on a patchwork of caregivers and done it myself and realized like that was the genesis of CareYaya. Similarly, in going through my wife's cancer care journey, we had fought so many health insurance denials and all these bills of different therapeutics she needed, even one major surgery that got denied. And in the midst of all the stress of dealing with a serious illness, I found it was insulting to end up fighting your insurance company. And we thought we had like good healthcare too. So I was like, okay, if this happened to us, imagine all the people that don't have, good health insurance plans. And then in the years of running CareYaya, I've noticed number one stressor of family caregivers beyond just managing the care is all the administrative complexity and fighting the bills people who are taking care of their mom or dad after a stroke, taking care of their spouse through a major cancer battle, et cetera. And these people are like drowning in medical bills and fighting stuff that they thought insurance would cover. So we built an AI system that is now backed by University of Pennsylvania and the National Institute on Aging and really informed by research on the AI picks the best strategies to help you appeal your insurance denial and is putting up pretty high win rates, like over 70%.
Wow.
And all people have to do is upload their denial letter, any background information onto the site of, the policy coverage document, any health records, et cetera. And it crafts like a very specialized appeal strategy for you in minutes. And it has done a better job than doctors in the field. Like we helped a lady overturn a $50,000 cancer tumor removal denial, where literally her surgeon had appealed twice and lost to the insurance company, and she was down to her last appeal. And her husband heard about it. And it's like an old lady living in rural Illinois, and she was like, "I guess I'm not going to get this tumor removed." And we were like, "No, like let's try to help." And they used the AI system, and they won. And it's really it's not even the surgeon's fault. It's just the surgeon doesn't have 8 hours to research all this stuff, right? So they're doing the best they can in 20 minutes, but the AI system in 3 minutes or 2 minutes can do 8 hours of human research and pick all the best citations and look through all the latest medical journals and put together a very robust case. So I think it's a cool way to democratize access to AI
But
to help
you
people.
need to you need to be able to give them the rejection letter. You need to be able
Hmm.
to put your policy. And I think that's probably
Yeah,
the key to
yeah,
the counterforce understanding that, oh, okay, now I can look at all the legal language and I can find all the policy exceptions that
exactly.
you're misusing. But then
And the
you also
medical, the two main reasons are medical necessity. So you have to make a case by looking at evidence of research papers journals of why does somebody need this procedure to get the tumor out? And in her case, it was a kidney cancer. The tumor was in a certain place. They couldn't excise it in the traditional method, so they had to use microwave ablation. So somebody has to go through tons of medical journal research papers to prove for this person and their health condition, this is the only way to do this. And, so that's AI can do that well. And then the second thing is a lot of times things are misclassified and miscoded. So you have to go through billing code databases and fix the coding. Both of these things are better done by technology because technology can do it fast. They could be done by humans, but it might take humans hours to do. And then because these hospital systems and clinics don't have the hours, they're typically not able to help you. Like the doctor's not able to spend 8 hours on your appeal letter because that would just cost so much money. So, and then the family's like, how the heck is a non-medically trained person gonna write a robust appeal to prove that this is the only way to get my tumor out? Like they're not
Not
gonna.
medically trained and
Yeah.
not legally trained
Yeah.
either. So because
Yep.
the policies are hard to read. I could have
Exactly.
used it this summer when I had a prior authorization rejected three
Mm.
times for a
Yeah.
medication I had been taking for years. And it
Yeah.
was a medication that I had taken after three other medications had
Yeah.
failed. And it
Yeah.
didn't seem to matter that that I had done all of this.
Hmm. That
I
happens a lot.
I
Yeah.
ended up writing the letter for myself, and I ended up writing the letter for the doctor's office for them to
Yeah.
sign because they were exhausted. They didn't have time or energy
Yeah.
to
Yeah.
do
We're
that
helping
for.
tons of doctors' offices. They're using this like 100 times a week on prior authorizations. And I think prior authorization getting worse and worse.
Yeah,
So yeah, I think that
harder and
it's almost
harder.
like, yeah, it's almost like the insurance companies have weaponized AI because they're using AI on their end. And then the small clinics, the doctors, the hospitals, and the patients don't have access. So we're like, okay, we'll like build something and like democratize access.
So just break it down, like from the patient perspective. They go on to the Counterforce website.
Yeah.
You've already talked about great results. So let's just talk about the steps and also about patient privacy because you are
Yeah.
putting up not just your medical records, but you're putting up your legal situation as
Hmm.
well.
Yeah. So all the data is individually siloed, so the data is not used for anything, but
Mm.
the data is needed to craft a good appeal. The How the patient uses is they go to the site, they create a username. It's free, by the way. There's no cost to anything. It's fully grant funded. They create a username and a password, so their data is siloed, secured, and then they upload relevant documents that they need. And then if you only upload the denial letter and nothing else, it will still do a decent job of an appeal. But if you upload your policy document as well as like any background health records, it'll do a better job. And then you get a letter in like less than a couple of minutes. And then it's like do whatever you want with it. Some people download it and just send it. Some people download and modify it, type it. Some people use it to inform research. And then the same tool is available for clinics. So we have a lot of clinics using it now. So I think that's been like kind of encouraging to see.
So is it free for clinics as well?
Yes. Yes, it's free for clinics. We have tons of clinics using it. Free for patients. We're grant funded, and over time, we actually have a lot of support from the industry. So, we think that pharma industry, med devices industry stand a lot to gain, from overturning denials of their products. So, exploring down the line, but for now, we have sufficient grant funding to keep it free indefinitely to people.
What happens to the medical records after they've gotten maybe you use it for the first appeal, then you go back
Mhm.
and you want to use it for the second appeal. Do you need to re-upload all the documents?
Yes. Yes, you need to re-upload because it doesn't store. So, I think that that's something that there's a privacy kind of centric design where like we don't want to store the data. So we have no use for the data. So you would have to re-upload. For some of the clinics, they want to design pilots with us and approach NIH for more research. So we're trying to create a more structured analysis of the data to show like evidence and outcomes. But we have no use of the data from an ongoing basis. So it's like whatever is used to process the letter, here you go. And then you
That
move
is
on.
so exciting. And you originally designed this for your clientele, but I
Mhm.
could use it. Anybody can use it, right?
Anyone can use it. Initially, it was just an internal CareYaya tool, and we observed that a lot of family caregivers were dealing with this. But then we
Yeah.
put it on a separate site and created kind of a separate name. To be totally honest, after the United Healthcare Luigi Mangione shooting happened, because people started flooding the site, and it was like, oh wow, a lot of Americans are dealing with this. Not just like people taking care of like older adults, but many young people, many middle-aged people, individual patients, family caregivers. So we're like, okay, there's an opportunity to offer broad access to people. And I actually think, I would hope that no one needs this tool. There needs to be better regulation and reform of the health insurance sector, but until and when that happens, God knows when, because I think these insurance companies, in my opinion, are doing illegal actions, like I look at all these investigations going on in United Health. So, but I think until that happens, I'm not holding my breath, tools like this will be increasingly needed because the insurers are now declining. 850 million claims were denied last year out of 5 billion in America. One in five American adults who is insured had something denied. And for many cancer patients, many dementia patients, like in cancer, the denial of claims is the leading cause of personal bankruptcy. So think about that. It's like sad.
Medical debt is insane right
Yeah.
now. So we're towards the end of our 20 minutes. What are your top 3 pieces of advice for caregivers?
Number one, get help right in caregiving, especially in long-term caregiving. Over 35% of caregivers die before the person they're caring for. It is a shocking statistic many people don't realize because of the stress, the sleep deprivation, and almost the PTSD that comes from doing caregiving. So make sure you get help, whether it's through us or somebody else. Get a few hours a week to yourself or more. Get other people to help you navigate the care work. I think number two, learn how to use technology to your advantage, whether it's like basic AI tools, whether you use Counterforce or even ChatGPT, whatever. Learn how to use tech to deal with health insurance bureaucracy. Learn how to use tech to figure out upskilling and what do you need to do? How do you do XYZ task in a better way to do care? Tech is now like your friend because there aren't going to be enough doctors and nurses to help you one-on-one. And then number three probably is get social support. Join caregiver support groups, join communities, find ways to chat with other people who are going through this because caregiving I've found is extremely isolating and it's extremely sad. So a lot of your traditional friends will not want to talk to you about it all the time, but why not talk with other people who are going through or who have gone through it? So I'd say those are probably top three.
Those are fabulous. And I listen, thank you so much for
Yeah.
your time and for all
Thanks,
this
Lily.
information. I'm really looking forward to talking to you again. I know you have some more
Great.
news coming up soon, so
Yeah,
perhaps we can revisit this topic in
sounds
a few
great.
months.
Cool. Sounds great. Thanks for the opportunity, Helene.
Thank
Appreciate
you.
it.
Bye-bye.
Bye.
Thank you for joining us today. If you want to know more about today's guest, the links are in the post below the video. And don't forget to like this video and subscribe for more fascinating people who are working to fix the American healthcare system for all of us.